Welcome to another installment of a self-quarantine version of Judgmental as Fuck. I am your host, and coming from a very safe and isolated place, Ken Black. And you can call me the Trap God Bravo. Now, usually we was going to stick to plan, and that plan was to talk about outrage culture and just how toxic that can really be. But you know what? Since last week I was feeling super lazy, and this week plans have changed for literally the United States. Plans is going to change for this show as well. And today we're going to talk about just how toxic a pandemic can be. Now, first off, we have to talk about what a pandemic is. Now, a pandemic is the global or regional spread of a disease, aka Covid-19. The coronavirus, or the Rona, as people on Twitter have lovingly referred to it as. But you know what? His daddy called it COVID. I'ma call it COVID. I ain't giving it no special nicknames. You ain't special to me, nigga. Fuck out of here. Now, according to, the way we're going to start is, we're going to talk about to panic or not to panic. Is this really something that I should be worried about? And listeners, let me tell you, yes and no. So, we've been listening to the news, and the news has been telling us for a while now, it's not that big of a deal. You should take care of yourself. You should be social distancing. You should be self-quarantining yourself, staying home as much as you possibly can. But for whatever you do not panic. And if you visited a grocery store recently, I would argue people have fucking panicked. And yet, if you look on social media and also the news, people aren't panicking. Because people are still out. I literally was out a little bit earlier trying to stay as far away from people as possible. I passed by a food line actually not food line. I passed by Walmart. Parking lot was full. Passed by Target. Parking lot was full. I went to a local park just because I wanted to get me and the family some fresh air, breathe a little bit away from the house, but somewhere that we thought that people really wouldn't be able to be close to us. We were wrong. It was packed with people just walking up and down the same trail that we were. Luckily, it wasn't that packed, and I'm a little exaggerating it right now, but it was a lot more people than we were expecting. And a lot of people were just taking their dogs out for leisurely strolls. But I'm in Virginia. So far, our number hasn't raised that much. I think the last time I saw a number for confirmed cases in Virginia, it was like around or less than 100. So, in my area, we shouldn't be panicking. That is the statement that I would officially make. But for others, that may not be the case. And here's why. See, the thing about COVID-19 that we have to keep in mind is that it is a respiratory disease, but there's a lot of like iffy information going on out there. And it's a lot of stuff that we can trust and a lot of stuff that we can't. See, it's already bad enough that we don't particularly in this country trust the media because the media hypes things up, the media blows things out of proportion, and sometimes the media will even go so far as to wholesale make things up. And unfortunately, the same can be said for our government. And that's why when this whole first thing started, the government was telling us that COVID-19 wasn't real and that it was a hoax made up by liberals and, people aren't dying from the disease and this, that, and the third. And it's not an American problem until it became an American problem. And then all of a sudden it was everyone should be locked down. And so I understand the confusion. It's a lot of like back and forth information. And one day you're being told don't stress about it. Nothing's wrong. Go to the beach and party. And the next minute they're telling you that all restaurants have been shut down. No one's allowed to dine in. If you're a waiter or waitress, guess you're assed out because you're not making money for a while. And that's feeding into people panicking. Now, like I said, a little bit of truth here about, let's call them little COVID, is that while it is a respiratory disease, people are akin it to a form of influenza. And a lot of people that I've been seeing on the internet, A, don't believe that COVID-19 is even a thing, and B, that it's not that serious. And from what I hear, there's been some differences. Like, I've heard some people say that people have gotten infected with the virus, and even after they recovered, they lost like 30 to 40% of their lung capacity, while others said that they completely recovered with little to no symptoms, and they were just fine. They were just mildly inconvenienced for a couple of days, and then they were good. There have been reports that you ain't even discover it for the first 8 to 10 days of you having it and potentially passing it to others, and that it may even take up to 2 months of you to recover from it, according to several health sources that have been reported through multiple news sources. There have been reports that if you are older or have some form of illness, that this could be basically a fatal disease for you. And the way that I've taken to describing it is that this is a cold AIDS. Pretty much that. It is the AIDS. It is the influenza of AIDS. You know, you can get it, and it's not necessarily going to be the COVID that takes you out. It's going to be the other stuff that you get because you got COVID that takes you out. And that is a very scary prospect for us. And it brings us to one of the main reasons why we are on lockdown now, which is, I know young people, you want to still go out, you want to still live your lives, and you kind of have to live your lives like before a vaccine comes out. I was going to say a cure, but as the doctors told us earlier today in the White House, there is no magic cure. Sorry, niggas. You're just going to have to deal with the potential vaccine or this whole thing just sort of blowing over. At the end of the day, we are in a situation where social distancing is our best course of action, and simple sanitary means are our defenses against it. You know, wash your hands, all the things you're supposed to do to keep yourself from getting normally sick. Just do that and you should be fine. Don't be all up in people's faces and super close to people because you don't know the germs that they carry. And I think the scariest part of the disease is the fact that it can be asymptomatic in some people. Like today, it was reported from The Hill that Senator Rand Paul from Kentucky actually is the first senator to be confirmed to have COVID-19, and he has reported that he is one of those asymptomatic people. And so no one knows if he's either been in the Senate and spread it around or not, or if he could have gone into the Senate and spread it around or not. And the only reason why he even checked was just because he and his team wanted to be cautious in preparation. And with the way that our government is handling things, we also have to deal with the number of testing that's actually involved, because as Governor Cuomo said during one of his press conferences, the more we test, the more cases we will find. And that means the more cases we find, the more we can work with things. Because the whole plan for dealing with this pandemic is to try to limit as much contact with people who may or may not be infected as possible. Because if we don't do anything, the number of people that are potentially getting infected rises significantly versus if we take very simple precautions, such as wearing personal protective equipment like gloves and face masks. Just covering, you don't even actually have to have a face mask. Just start buying bandanas and watch out for your local gang colors so you don't get caught up in that. And you can pretty much protect yourself from it. And if you're not worried about protecting yourself, that's fine. I understand. I get it. You're not really stressed because you're young, you're healthy, you're not that concerned. But you might want to be concerned for the people around you that aren't. I know if I were to come down with it, I would have to find some way of quarantining myself away from everyone else in my family, particularly my mother and my grandmother, who aren't in they're not unhealthy, but at the same time, I wouldn't want to see them get the disease and have to deal with that. So I've said a lot here, and it's a lot of information. It's really confusing, and ultimately with like Twitter and everything, and people just saying things out their mouths that are true, may or may not be true, with people being upset that some people get tested and others don't, whether they're based off of symptoms or not, just simply because they have money. I understand your feelings and I understand the frustrations, but ultimately you have to decide for yourself whether you want to panic and start trying to take care of as much stuff as possible now, or you don't want to panic. For me, I'm heavily suggesting don't panic. This whole thing's going to level out. And if you are going to panic, the thing to panic about is as our financial system, because this whole pandemic thing has really exposed just how fragile America's economy really is. Where if some global event occurs such as this, we pretty much kill off the financial viability of minimum 30% of our population, just because of the fact that I forgot the exact number, but the number of people that work retail jobs retail jobs is one of the highest number of jobs of working in America. And if people aren't allowed to go to stores and shop, or if people aren't allowed outside, those jobs are shot. I think the next highest job is in the food service industry, and if you can't work in food service, such as being a cook or a waiter or waitress, you can't go to work. That is a significant number of the population unable to earn money off top. And unfortunately, in America, your bills will not stop just because you can't pay them. And we're trying, and it looks like our government is actually trying to come up with ways to combat this. But at the end of the day, you can't really combat the way your system is set up. You know what I mean? And maybe it's the best way. All this thing has taught me so far is that a liberal's plan to care for people isn't do enough, and a conservative's plan to have everyone take care of themselves definitely doesn't work. So we got to figure out something, people. And this whole question of panic or not panicking actually leads to the one of the first things that they tell you to do, which for when preparing for a pandemic. One of the first things they tell you to do is to start stockpiling food and water. That doesn't mean be stupid, but make sure you have some extras for food, water, medications that you might have. Make sure that your supply doesn't get low enough that you run out. Pain meds, vitamins and nutrients if you might so happen to take them. Make sure that you have electronic medical records on standby in case you have to go somewhere that you don't normally go in terms of getting taken care of medically. And this whole thing, it just showed me that people buy the stupidest and stockpile on the stupidest things when they're in a panic. They really do. Like, why are you buying so much toilet paper? I don't understand it. COVID-19 doesn't cause explosive diarrhea. You don't need the toilet paper really should not have run out completely. And every store I've gone to has been like a temporarily out of stock sign in terms of toilet paper. Hand sanitizer, I understand. Unfortunately, that's not the case for soap, which is weird. Maybe you guys should go back to washing your fucking hands, but whatever. We'll move on from that. I've seen people stockpiling on like pastries and stuff, and not even like the pre-baked kind, the actual like you have to bake it yourself. Like I couldn't find any like brownie mix just while I was out shopping a little bit earlier trying to find some tissue paper. That was crazy. There's no crackers around. There's no bread, which is understandable. There's no milk, which is yet again understandable. I understand, like the things that make sense made sense that they were missing. Like bread, milk, eggs, some forms of meat. Meat was missing, like almost all forms of meat, with the exception of like some of the organic chicken. And it's super funny just seeing the pictures that nobody wants to eat fucking vegan food in a pandemic. Their stores will be cleared out with the exception of that. Not unlike the canned food isn't really touched. Like nobody wants fucking vegetables at a time like this. And then someone brought up a very good point where it's just like, why would I want to buy vegetables when people could be touching it? And now my fucking vegetables have COVID-19 on them, which I thought was fair. But then it didn't make sense that the canned vegetables were still untouched. So, it is what it is, man. But, when you're out here stockpiling, if that's what you're going to do, when you're doomsday prepping, just be sure to keep in mind other people. Because if you don't need it, maybe you should save your money and not buy it. It's okay if you want to, and if that's your prerogative to take care of you and your family, that's on you. But just know that we are social creatures and we're in a very big community. And at the end of the day, we kind of have to work together. Otherwise, people's going to start knocking on other people's doors asking for shit. And you ain't going to like it when that happens. And next thing you know, it becomes a case of, do you own a gun or not? We don't want to get that far. I personally don't think it'll get that far. Like, I think that hopefully things will turn around within the next week or two. But, only time will tell. And, when you think about all these stockpiles, you got to think about how people have to make adjustments within their lives. And, earlier we talked about how people have, to go to work and how people now have to work from home and kids don't have school. So now someone has to be home with the kids and all these adjustments to life. And it's stressful. It's stressful. That's all. That's the only word I can put for it, because I can't really give you advice on how to adjust for your own life. I can tell you that right now I have to deal with trying to figure out exactly where I'm going to move to when my lease is up in June, because I'm moving in June, and not only it's not like I'm just moving from my place. I'm moving to another state. So now I have to keep eyes on their news, whether they're still renting places, whether jobs are hiring in this time. Like, where am I going to be able to get money? Where am I going to be able to take care of my family? Where am I going to be able to move during this whole thing? Because, like I said earlier, this whole shot at a vaccine is a minimum of a year away. At its absolute fastest, it cannot be any sooner than a year away. So, knowing that means that we have to know that this thing is, we got to make some adjustments so that we can live. And that's one of the main reasons why stockpiling is a little toxic in this situation. Yes, you should buy what you need, but when you go overboard, then you don't have what you need later. Because you bought everything out early, and you think, oh, well, I mean, if I already have it, that means I should have it to keep. Yeah. Unless it's something that perishes, in which case now it'll go bad and you're going to look stupid. And then you have the next one, which is another sign that people are panicking a little bit, is the ever so helpful conspiracy theories that come out about it. The conspiracy theories that COVID-19 is all a hoax and it's fake. It's not even actually from China. It's man-made, which I'm pretty sure that's actually true. And that, they're just doing population control, which doesn't make sense, because if you're doing population control, it would make sense to use a lot deadlier disease. Oh, they're just doing it to, the government is behind it. And like I've always said, when it comes to conspiracy theories, if you can't come up with a good reason other than that's just what they do, for the reason and an explanation of why something should be happening, you should probably rethink your conspiracy theory. Do I think that COVID-19 is handmade? Yes, I do. Why do I think that COVID-19 would be made in a lab somewhere? It's very simple. Because governments create viruses all the time. It is a form of bioterrorism. And at the end of the day, why fight a war when you can just unleash a disease on the people? It's simple. Like, so at the very least, think about the things that you hear from other people. From like, I think earlier this week I heard some dude talk about how he thought COVID-19 was a hoax and that it was fake and they're just trying to take your rights and freedoms away. And while I don't disagree with the premise that, so losing social liberties in this time for the security of others isn't a great thing, I agree with that wholesale. But at the end of the day, if you think that America, the capitalist country that it is going to sacrifice its fucking economy and all the rich people that would have to deal with it and agree to it are going to sacrifice all the money they would make, all so that toilet paper and Purell hand sanitizer can make a lot of money, you're probably high. It doesn't make sense, man. Go back, rethink this theory again, come back to us later. And now it comes to an important part that I don't think people are really thinking about, and that is coping. Because if you've been a listener of this, you should know that I'm a psychology major. I have my master's in psychology. And at the end of the day, I originally wanted to start this because I wanted to investigate the psychology between fetishes and like people's toxic behavior. And so all this behavior with being self-quarantine and social distancing, we have to remember that social distancing and quarantine, it can lead to fits of anxiety and social isolation. And unfortunately, those two things are unwanted consequences for pandemics. And when you're dealing with this, you have to come up with a way to cope with the social isolation, the deprivation of doing the activities that you want to do best, like going out and eating with friends or going out to the club and partying on the weekends. The boredom and can additionally stress you out. Not to mention the stress of being in close quarters with your family with no real way to get away from them and no outlet. Now, then you have the deal with people who have pre-existing anxieties, people who are germaphobes or OCD. Like, if you are dealing with these things, if you deal with anxiety, if you are feeling socially isolated, if this whole thing, pandemic, is not working out for you mentally and your mental health is starting to fail and you're starting to slip into depression, you're starting to slip into anxiety, you're dealing with these things, just know there are people that can and will help you. Find a way to cope with COVID-19. You can find your own ways if you like. If you don't feel like that your issues are that major, you can reach out to a mental health professional, phones, emails. You can talk to people who are professionals in this line of work. And they will gladly help you. And guess what? The best part is, when it comes to coping and psychological help, you don't have to do it in person. You can do it over the phone. You can do it through text message. You can do it through emails. You don't have to be alone. And if you really feel more comfortable seeing a person, you can always do them via Skype. These are trying times right now for everyone. Like, whether you're struggling financially, struggling with your health, struggling with anxiety, struggling with dealing with all the other people who are freaking out and stockpiling on stuff, so you are unable to get your basic necessities met. Just remember and realize you're not alone in this. Attacking people and getting angry on the internet isn't really going to help you, but if that's how you cope, then just keep in mind that other people might have that same energy for you. Maybe we'll cover that on Outrage, the next episode, whenever we do Outrage. But that's all I have for today. I wanted to make this a little bit more entertaining, but as I was getting into it, this whole COVID-19 thing is a little too serious to be lobbing jokes throughout the whole thing. So I hope you got something out of this. I hope you stay safe. Pete, share it, like the video, share it with your friends. If you like it, make sure that others can like it too. And if you don't like it, make sure you share it so that other people can shit on me too. This has been JudgementalAF, and I am your Trap God Bravo. And you have a lovely evening. Peace.